Hello, everyone. This is Francine Crawford, and this is Autumn is Here. Welcome to Autumn is Here. Today, we have a special guest from MJHS. She is a physical therapist there. Welcome, Rosemarie Ho, to the show. Hi, Rosemarie. How are you?
Very well. Thank you for having me.
Good. I'm glad that you took the time to do this. I appreciate it. Appreciate this. Tell me just a little bit about yourself.
Well, I am a physical therapist, and I've been working as a physical therapist since 1981. So it's been 42 years. At first, I worked at a hospital setting, and then a rehabilitation setting. And then for over 15 years, I am now working at MJHS Home Care.
Oh, okay. Awesome. So what got you into being a physical therapist?
Well, it started in high school when I was taking a required gymnastics class, and I had to use my analytical skills for movement to pass the class. I did not have a gymnast body. All right. And I found out early that I liked to analyze movement. And I found out early that in gym, your body always follows your head. All right. If you want to go into extension, you have to move your head up. And that helped me pass the class. And I thought how wonderful it would be to use this skill that I love in a career that would also help people.
Awesome.
So physical therapy really, fit the bill.
Oh, awesome. Okay. I just wanted to just let you know that the Autumn is Here is about getting people more involved with their aging parents, their families, giving them things to help them, to speak to caregivers. A lot of times caregivers don't know exactly what to look for and things like that. So tell me, how do you assist in the aging community? How do you assist them in physical therapy?
Well, MJHS Home Care we see patients that are homebound, and many times we get referrals from physicians from the hospital or the physician's office after they've had a stroke, after they've had an orthopedic procedure like a hip or knee replacement, or it could be after congestive heart failure, or after a fall and they've had a fracture, or they've had a fall and had a lot of soft tissue injury. So our goal is to get them back to where they were before their hospitalization. And what we do is a very, very thorough evaluation when we first see them to see what their needs are. Their family situation, their home situation, their neighborhood situation, and what they have available to them, and whether they have caretakers that will be able to assist them in their rehabilitation. And we find out what their weaknesses are. We do the basic physical therapy evaluation of manual muscle testing, range of motion, functional activities. We evaluate how they do it. We see them actually do it. We ask them to do it. And depending on what their needs are, we work on a program with the caretakers and the patient to move them along, and we make our visits accordingly.
Okay. So is there anything that you see that is more common as people get older that happens, that you have people that are coming into your office that are with different illnesses that are more common as you age?
Yes, a lot of times we see patients with balance problems.
Okay.
And we do test balance. The first thing, one of the first things we do. And a lot of times balance is involved, and we do work on balance exercises. And it just varies a great deal. Like with a COPD patient, we have to work on breathing exercises. We have to work with them using oxygen. So with the elderly, there is such a gamut of of diseases that we see. So it's hard to pinpoint one, but with the aging, it varies.
Right. Okay. Okay. That's interesting that you said that about COPD patients, because I never think about physical therapy in that way. I think about your arms and your legs and things like that. Breathing is a part of it also.
Yes. There's a whole field for chest physical therapy and there are many different parts of physical therapy. Yes.
Oh, okay. Okay. That's interesting to know. As far as caregivers, there's exercises that you would tell them to do at home. Are there things that they can do that you can teach them to do while they're at home to keep them?
Absolutely. Depending on what they have for support, if it's a home health aide and they're living alone, even an activity like coming up to stand every waking half hour instead of sitting and watching TV the whole time, or reading a book for an hour, for hours on end. And if they watch a lot of television, we try to incorporate activities like when the commercial comes, please stand up. So that's your signal. And we give them home exercise programs that are with pictures, so that the family and the home health aides can help them. And they can be very simple, as sitting exercises, standing exercises, depending. And some of them might have to be in bed initially, and to make it safer for them. If they're alone, they can work on the bed exercises. When the home health aide comes, they can work on the more involved exercises. So depending on their situation, yes, we give them a home exercise program, and we hope they take it seriously and work with it.
Okay. And with your experience, you've seen like the benefits
absolutely.
Of them getting well. Is there any story that you could share with us of someone who, had a great benefit over physical therapy, but using physical therapy?
Yes, so many stories. And we usually see it in their function. All right. A knee replacement. Initially, they can't get out of bed by themselves, and then we go over the skills that's needed. First, assisting them in bringing their legs over the bed, and then afterwards they're able to go into the bathroom and they're able to walk, and then we work on exercises to get them further and further, bending their knees and getting them to get up more easily. We see it in their function.
Okay. Okay. Awesome. So with caregivers that you give them instructions, they don't have to have special training, do they? Or, the instructions that you give them to use to help their loved one?
Well, the home health aides do have training before they go on with their agency, before they come on to when they're at their agency, when they're hired, and they do have certain skills to assist the patient in personal care, and also light housekeeping to help the patient since they can't do it themselves. And yes, they do have the skills also to guard them, and we reinforce that with them because different patients need different assistance. Mm-hmm. So we tell them, this patient is very unsteady and she buckles a lot. You really need to put your hands on when she walks, or she really has a lot of weakness. You need to help her. If it's a private hire, we ask them, you have to help them lift up the leg first so that they can do the exercises. And we try to give them, maybe if you put a plastic sheet or a bag underneath the heels, they can move better. They won't need as much assistance. We give them tips to how to move better.
Okay. Okay. Is there equipment that you use or that you give to the people that are homebound?
Well, a lot of times, and patients are not aware of that, but they durable medical equipment to assist them with the walking. If they just have a cane, they've been using a cane only, but they need more assistance, like a walker. Equipment to in the bathroom, a shower chair, grab bars, and a raised toilet seat for next to the bed if they can't get to the bedside. We recommend equipment for them. And then for exercises, we do provide elastic bands for them if they need resistance, but mainly we use function, like getting out of bed more, or getting off the seat more often to use the muscles in a function to reinforce strengthening, reinforce the activities.
Okay. Okay. Awesome. So let me say, let me ask if there is something that you would say to a caregiver. I know that you give them instructions, but also in caring for someone, do you give them pointers about, patience or anything like that, or to use in doing these things? Because sometimes it takes a little while for the person who you're taking care of to understand exactly what you're telling them.
Yes. Or like patients, their patients in dealing with them. Yes. Yeah. Often you see a patient struggling, the family members, and you just want to do the activity for them.
Right.
Like if they had trouble putting on their shoes and socks, you said, "Oh, let me do it," and we encourage them to give them the opportunity to do it, and to lean forward, at least to put on the shoe, even if they can't tie their shoelaces. All right, to reach over, because that involves bending down and getting the movement for getting up to stand if they lean forward. Leaning forward to reach to put on their shoes. And we encourage the family to allow them to do it. And it might mean taking a few more minutes to do the activity. And we encourage them to allow them to do it. Yes.
Okay. Yeah, I just can imagine that sometimes you want to do it for them, or it takes them a little while, and some people can get impatient, or you don't know what to do to encourage them to actually continue with the exercise.
And I tell them the more they practice, the easier it will get for them. And I said, if you do it, you'll get stronger, and if they do it, they'll get stronger. And then that kind of sinks in. Okay.
Well, thank you for your information that you've given us. Is there anything else that you want to say to caregivers? I also want to mention that this month we have Asian American and Pacific Islander month, and we're celebrating that. And I want to know if there are anything that you want to say that you get involved with, like, do you use your culture in any way in the work that you do?
Oh, yes. I am bilingual. I speak Cantonese. And right now I have a patient that speaks Cantonese. And I use, I guess, my cultural sensitivity in addressing them. When I go into a Chinese household, I would ask them first, "Oh, do you want me to take off my shoes?" Because that happens a lot. We're used to going home and taking off our shoes when we were little, and they are very happy. They said, "Oh, no, it's okay." Or I said, "You know what? And I see them all bare feet, and I'll say, "You know what? I'll put on these booties on my shoes," and you get a smile because I carry them with me, and sometimes they'll have slippers for you to wear, and that's fine too. And then I address them initially with like Mrs. Lee, and then they says, "Oh, that's so formal." I said, "All right, can I call you Paw?" Like that's Chinese for grandma, if they're elderly. and she's, oh, whatever you wanted, but you see a smile, and then they open up to you more. And I use my language skills to assist them. Sometimes they'll have mail. Oh, can you please read this? Is this important? I said, oh yes, please save that. Your daughter needs to read that. This is regarding your Medicaid, or this is regarding your monthly payments, So I assist them, and then they open up more because I'm assisting them in a different manner of translation and helping them. And they are not bilingual, so they need help, especially with durable medical equipment. They don't know what's available to them. And when I see them and I treat them and I tell them, this is what you need, they're very pleased that I can get it for them and order for them and ask their physicians to sign off on them.
Okay. Oh, that's great. Is there any kind of beyond you? Is there any program or anything else that they have that will help them to translate or get more information beyond seeing?
In their communities, they have services.
Okay.
The Town Planning Council, they do have social workers there. Okay. Yes, and they can send their home health aides there if they can't get there themselves, or the home health aides can take them in a wheelchair. Yes, they do have them, and but many times, when they're home, they say, "Oh, if you're here, can you help me?" And yes, but for long-term assistance, yes, for translation, Chinatown Planning Council.
Okay.
CPC. Mm-hmm.
Oh, that's awesome to know. Wow. And I'm sure it makes them more comfortable when they see you and you're able to communicate with them,
yes. Mm-hmm.
Especially with the aging adults. I'm sure they feel that that's a lot of help, and they just seeing you and knowing that you understand the culture and you can relate to them really makes them feel comfortable.
Yes. They feel a lot more comfortable. Yes.
Yeah. Okay. Well, thank you so much for all this information. I appreciate you taking the time to talk to us about physical therapy. And I thank you for just coming out and talking a little bit more about just aging. It's so important because your body breaks down. It's going to, and some people don't think that it works. Physical therapy is really going to help them in a sense because they don't take the time. I know it takes a little while for it to where you have to be patient with it because it takes a little while for people to get it. Yeah. So,
and yes, that's why we see them and we encourage them and we get their family to support them as much as they can.
Oh, excellent. So thank you so much for being a part of Autumn is Here and sharing with the audience and giving people information on this. And I just so appreciate it. Thank you again, Ms. Ho.
Thank you for having me.
Okay. Have a great day.
Thank
Bye-bye.
you.